Good morning or afternoon. This is week 4 and we're going to be discussing post-operative care. Do a little recap. Let's see, when does post-operative phase start? When does it start? It starts when the patient is transferred to PACU. What are we focusing on during this phase? We're going to be focusing on the recovering of the patient, relieving pain, and preventing post-op complications. And when does the post-operative phase end? It ends when the patient has met their full recovery. Transferring them to recovery or PACU. How are we to do this? First, you need to use caution. You do not want to have any strain on the incision or the sutures. You're going to move these patients slowly and carefully. You apply a dry gown, light blankets. You're going to raise the side rails, strap them to a stretcher if necessary or required. These patients may be restless or have excitement as they recover from anesthesia. And the anesthesiologist or the anesthetist are the ones that transfer them. Let's see, why do they transfer them? The anesthesiologist or the anesthetist is the one who gives report to your nurse. That is why they are required to do the transfer. Nurses in PACU are specifically trained. The surgeon and the anesthesiologist will monitor the patient in recovery. Our responsibilities. What are the nurse's responsibilities? We are to monitor the patient closely. We are to utilize special equipment. We are to give medications. We are to replace fluids. The PACU or recovery is always located close to the OR, so there's not as much transfer needed. So what exactly do we need to know? What report do we need to get from the anesthesiologist? First, you always need the client's name, gender, age, if they have any allergies, were there any language barriers before surgery, the length of surgery. We need to know how long were they in the OR, how long were they under anesthesia. We need to know medical diagnoses, the type of surgery performed, airway patency, vital signs, blood pressure, medications given, any problems that occurred in the OR. Any kind of pathology report, and if it was reported to the family, fluids and the amount that was given, any kind of blood loss, and if they had to replace anything. They also need to know if there's any tubes or drains or catheters that they need to monitor. They need to know the specific instructions, and they need to know the location of the client's family. So now they have transferred the patient into PACU. We have got our report. Now what? Now what do we do? We're always going to check the airway, respiratory rate, and rhythm, depth. We also need to check their pulse, their blood pressure, skin color, level of consciousness, or the ability to respond to commands. We always need to check their operative sites, their drainage. We need to check for hemorrhage or any complications, which we will discuss in a little while. We need to make sure if there's any tubes that are clamped or needs to be unclamped. And we need to evaluate, report, and chart the significant pre-op history. So what are some nursing interventions? We've talked about some in your assessments, but you're going to monitor vital signs, physical assessment. How often do you do these physical assessment? It's going to depend on the surgery, but it's normally every 15 minutes. Remember to always assess your ABCs, airway, breathing, circulation. You're going to monitor the condition of the surgical site, function of the central nervous system. You need to keep an airway clear of secretions. This means you may need to keep suction close to the bedside. If you ever have to remove any oral airways. When is it okay to remove an oral airway? When they show signs of gagging or per your physician orders. We need to make sure we're relieving pain and maintaining patient safety. We need to provide emotional support. The patient remains in recovery until they are fully recovered from anesthetic agents. So how do we know if a patient is fully recovered? They need to have stable blood pressure, adequate respiratory function, a reasonable degree of consciousness, return of motor and sensory. All vitals are stable. No evidence of hemorrhaging. The patient is oriented or back to the normal level of orientation. They have urinary output greater than 30 milliliters per hour. Nausea and vomiting is under control. The pain is adequately controlled. And they have to have an Aldrich system score of 9 or greater. If you will look in Blackboard, I have a chart in there for you to view. Now we have a patient who is fully recovered. Now we have to transfer them to the floor. What do? You need to make sure that the unit is prepared to receive the patient. The PACU nurse records baseline data condition. And what would we include in this report? If you look back, you're going to record and you're going to report everything that the anesthesiologist gave you. You're also going to include any other medications that you gave them post-op, any new complications that you experienced in PACU. How were they nausea and vomiting the whole time? Have they been good? Did their O2 ever drop? Any kind of complications that you experienced during the PACU experience. So what do we really need to report or watch for? What we're looking for is a temperature greater than 100.4 or below 97 degrees. Respirations that are over 30 or less than 20. Blood pressure rapidly dropping or below 90. Systolic. Look at any kind of discolorization of the skin, and excessive mucus in the throat or nostrils. These all need to be reported immediately. So we have walked through the basics of what happens during the post-op. Most important thing, we're looking for post-op complications. So post-op complications can range from many different things. The first post-op complication that we're going to be discussing is hemorrhage. So what is hemorrhage? It is an excessive internal or external blood loss. This can be categorized in 3 different ways. You have primary, which occurs during surgery, intermediary, which is within the first 24 hours, and then you have secondary, and this can occur 7 to 10 days after surgery. A common for the secondary is if sutures break. There are 3 different types of vessels that they can be bleeding from. You have capillary. If they are bleeding capillary, it's going to be slow, generally oozing blood. And you have venous. Venous, it bubbles out quickly and it's dark in your color. Arterial is bright and it spurts with each heart rate or each heartbeat. So what are some clinical manifestations or signs and symptoms of hemorrhaging? It's going to depend on the amount and rate of the blood loss. Usually you will have restlessness, thirst. The skin will be cold, moist, and pale. The vital signs, this is why you always take your vital signs. Your pulse rate will increase. Your temperature will fall. The respiratory rate will increase. You will have a decreased cardiac output, you will have a decreased blood pressure, and you will have decreased hemoglobin. Your lips and conjunctiva can be pale. Patient may complain of seeing spots or have ringing in the ears. This leads us to our second post-op complication of shock. Shock is the body's reaction to acute circulatory failure. The most common seen in postoperative patient is hypovolemic shock, which is a decrease in the blood volume. aka they're hemorrhaging out. Signs and symptoms are going to be the same as hemorrhage. So what are we going to do for these patients? What are some interventions? First off, you're going to notify your surgeon or physician. You're going to make sure we can maintain an airway. We want them to lay down flat with their legs elevated 30 to 45 degrees. You want them to have O2. You're going to continuously monitor their vital signs. Are they getting worse? Are they getting better? Are they staying steady? We're going to monitor any blood work and maintain the body temperature by placing covers on the patient. Another post-op complication is deep vein thrombosis, or a DVT. You need to identify if the patient is at risk for a DVT. Some examples would be if they're an orthopedic surgery, if they're older patients, if they're obese, if they've had complicated surgeries, if they've ever had a DVT in the past. Those are some examples of patients that would be at risk. What are some signs and symptoms of a DVT? This is usually pain or cramps, especially in the calf, pressure area that causes pain, swelling, slight fever, chills. And what are we going to do if you have a patient that has some swelling? How would we monitor that swelling? Biggest thing you need to remember is you're going to measure the calf size. And what is something we need to avoid? You always want to avoid massaging the leg. You need to make sure the patient knows not to massage the leg, because this could make the clot dislodge. How do we prevent a DVT? This is going to be when you have leg exercise post-op. You have early ambulation, use of low-dose heparin or Coumadin, depending on the patient's physician orders. These patients can have TED hose. You want to always avoid rolling blankets or placing pillows under the knees, or having patients have a prolonged dangling of the feet. Some active treatments for the clot would be a ligation of the femoral arteries, which is a surgical tying of the vein. These patients can be on anticoagulant therapy, so it can be used as a prevention and a treatment. You're going to monitor PTs, PTT. These patients need to be in thigh-high TEDs to decrease swelling, and they can have their legs elevated to also decrease swelling. Now let's talk about some respiratory complications. The first respiratory complication is a pulmonary embolism, or a PE. This is a blood clot or a foreign substance that is dislodged in the pulmonary vessels. Some signs and symptoms. How do I know to notify the physician that there's a possibility of a pulmonary embolism? These patients are going to complain of dyspnea. And it's very sudden dyspnea. These patients will complain of chest pain, cough, cyanosis, tachycardia. They will appear very anxious. So what are we to do? We have a patient has these symptoms. Now what? You need to notify the physician immediately. These patients will be on bed rest in semi-Fowler's position, and you will need to administer oxygen. Then you also have another respiratory complication of atelectasis. This is a collapse of the alveoli. The collapse of the alveoli causes a decreased gas exchange. So they're not getting that O2 into the system. So what are some signs? You're going to have decreased lung sounds. You're going to have dyspnea. You're going to have cyanosis. They could have crackles. They will appear restless. So now we have this patient. What's going to happen? What are we going to do? These patients, for the preventive, they need to be the ones using incentive spirometer. They will need to also set in the semi-Fowler's position, and you will need to provide oxygen. Pneumonia. Pneumonia is the inflammation of the alveoli, which we've already said decreases your gas exchange when there's an alveoli problem. This is caused from an infectious process or any kind of aspiration. What are some signs and symptoms? These patients are going to be the ones with fever, chills, a cough, and the cough can be rusty or purulent sputum. They can also have crackles or wheezes. They will also have dyspnea, chest pain. What are some nursing interventions? You want to fix the related cause. If it's an infection, you want to give antibiotics. You're going to place these patients in semi-Fowler's position. You want to use the incentive spirometer, early ambulation, and these patients may also need oxygen. Urinary retention is also a big post-op complication, especially with those lower abdominal or rectal surgeries. What are some simple things that we can do? As nurses, no medical order required. First, you want to try to set the patient in the natural voiding position. You're going to provide privacy. You can run water in the background. You can place warm water over the perineum. These patients, you may also need to bladder scan them. What do they even have? Do they have enough to even need to void at this time? We need to monitor if how frequent are they going, or have they not voided at all? Gastrointestinal complications. This can be intestinal obstruction, which may follow an abdominal operation. So what are symptoms of gastrointestinal complications? They're going to complain of abdominal pain. They could have hyperactive bowel sounds, vomiting, no bowel movement, abdominal distension. Treatments are usually going to have your NG tube. If it's constipation, they may increase the laxatives. Patients freak out sometimes when they are passing gas. Passing gas is actually a good sign because it means the digestive tract is beginning to function again. Patients need to have a bowel movement within 3 days post-op. These patients need to look for paralytic ileuses, which is when the paralysis stops completely. We also need to help with post-operative coping. Why would patients need to cope? This is going to go more towards surgeries that alter the physical appearance or the function of the body. Many surgical patients have the same reaction to the loss of a body part as they do to a death. How they adapt relate to multiple factors, including age, culture, significance of that body part, the visibility of the body part, how much time did they have before the surgery happened? Were they aware of it, or was it an emergency surgery? Also, the support that they have will help with the adapting. What are some nursing interventions? We need to make sure we're accepting each patient. Each patient is not going to react the same, and we need to accept that that's how the patient is going to react. We need to allow time to verbalize feelings. We need to help them identify effective coping mechanisms. We are going to provide any teaching, and we always make sure that you are honest with your patient. So now we have got our patient through the post-operative care, and now what do? We have to make sure that the discharge instructions are given to the patient. This is going to include any wound care they need, any follow-up. You also need to educate them on what they need to tell the doctor. They need to know signs and symptoms of infection, dehiscence, bleeding, the signs and symptoms of bleeding, temperature, increasing pain, limitation of ADLs like mobility, if they can shower versus bathing, and how they need to control their pain.